Well, I've actually lived in the States. I spent 6 years in the States, and bar none, hands down, this system is better.
The care that you gotten, has it been good?
Oh, excellent. No complaint.
Have either of you ever had to go to the U.S. for healthcare?
No. Who wants to? We have everything in Canada. I want to make that quite clear.
I would choose Canadian healthcare. I had a bad leg infection and they're treating me wonderfully. I went into emergency here and I was taken care of within 5 minutes.
Okay, I'm a member of the Conservative Party of Canada. I'm not a socialist. Most Canadians of all political stripes seem to prefer a public health system.
I probably have to stay here for 8 days.
And how much are you going to pay?
Nothing. My medical pays for that.
How much do you pay for that a year?
It's $56 a month.
Where are you from?
I'm Jennifer Stevens. I'm from the U.S.
And where do you live now?
I live in Vancouver. My husband and I immigrated to Canada 2 years ago because I was a nurse there for many, many years in Portland, Oregon, which was a very progressive town. And I thought that it would have the most progressive health care as well. So I worked very hard, as did many people, for many years trying to get universal health care in Oregon. And unfortunately saw it fail year in and year out over and over again. And as an oncology nurse at a very large hospital there, I just couldn't participate in the system of business and profit making anymore. So I came here.
The disconnect that I don't understand is it seems like people fear that the government will be making healthcare decisions for individuals, and the government here has no involvement in that decision. It's really entirely the doctors. Anecdotally, I also would hate to have insurance companies dictating what level of health care I should be getting and what treatments I should be getting. In the Canadian system, I believe that the doctors have full authority to make the right decision for their patients, and they will always get paid regardless of those decisions.
Initially diagnosed with breast cancer in 1999, and the first thing my American friends said when I told them was, "Oh my God, you're going to be bankrupt. Are you going to be okay financially?" And then another, my partner, who was from the States originally, said, "No, you don't understand. It doesn't cost anything here." I said, "Yes, it does. It costs $720 a year." Because you see, that's the base rate. I had extended as well because I'm a high school teacher. But I didn't need the extended, actually.
In Oregon, I would have patients who would choose not to get treated for their cancers because they knew that it would cause financial difficulty, if not bankruptcy and ruin for their families and themselves, even when they had health insurance. So for me here on our floor, we work on the bone marrow transplant floor. We're able to treat patients and to give people transplants no matter what their economic background. And that has been a phenomenal change in my life and in my patient care. And it's been touching, and just based on that alone, I feel so blessed that I was able to come to Canada.
This week I went to see my doctor, and it's been the same doctor since I was born, and I'm now 69, so it's like third generation of the same doctor. I'm very lucky. We are very lucky here.
I work as a nurse in a family practice of 6 doctors in Hamilton.
I'm a nurse, but I work in management in primary care in England, in the NHS.
So, your healthcare system or the US's?
No question, Canada every time.
Well, I prefer our healthcare system.
The healthcare in Canada is the best. US should follow it.
Well, we only know one system, which is ours, and we like it very much. Yeah.
I couldn't imagine going into debt for the rest of my life just because my child got sick.
I had a detached retina. I saw my doctor yesterday at 2, and I had an appointment down here at 8 o'clock this morning. We had to drive, so that's pretty fast, eh? It cost me for eye drops. It cost me, that's it, gas driving down here, staying in a hotel. It's going to cost me about $500 for accommodations, food. More than that, probably, driving down.
But the medical costs?
Medical costs are nothing.
Have you or anyone you known either waited in line or gone to the U.S. for healthcare?
Well, I have family that live in New York, and they, I think they've waited in line, I'm sure. Yeah.
In New York?
In New York, yeah.
No, and I hope that I never do, because I think the American system is backward, and in this day and age it should be way more sophisticated, and they should have access for everybody to have Medicare in the States.
Do you know anyone who had to go to the U.S. ever for care?
I myself did once. I was in an ambulance being taken to in Los Angeles, being taken to a hospital, and I heard two fellows in the front go, "Where should we take this lady?" They said, "Well, maybe we better take her to county. We don't think she's got any insurance." And I yelled from the back, "I do have insurance. I've got BC Gold and I've got Canadian medical insurance." And they immediately turned around and took me to the university hospital, where I had a very good procedure. But that was only because I had Canadian health insurance. So, and as for people going to the States for procedures, no, I don't know any. Why would they?
My name is Jerry Wanick, and I'm from Kohler, Wisconsin. If I had a choice, I would take the Canadian system. And I'm saying that from a place where I have great health insurance. I've never been refused. But I live in constant fear that if my job goes another place, then I will be left as an uninsured person, and there's no way, because I have had heart surgery, that I know no insurance company would ever pick me up.
One of the heads of our program, a physician, is from Texas, and he and I regularly talk. We would not go back to the U.S. We are very pleased with our Canadian healthcare system, both working for it and with being patients in the system as well.
I'm 66, sorry. I have enjoyed prompt attention whenever I had the needs. I've had 2 or 3 operations. I see my family doctor whenever I want to see him. There are no problems seeing that. I think we have the peace of knowing that we don't always have to scrimp and save and worry about where we're going to have to find the money to deal with our needs. And our children have all enjoyed the same benefits as we. Pregnancy and birth of our children and grandchildren was never an issue.
I have arthritis, and I got it when I was in my early 20s. And already the insurance company, I had a great job as a civil engineer, and the insurance company was starting to give me a hard time. You know, I can't remember, I think I had to change the policy or start looking for another policy. In the end, I ended up moving back to Canada, but that's my personal experience, and I've heard that from a lot of people.
I would prefer Canadian healthcare system. I think healthcare for all is a moral responsibility. I think the coverage is very good here. I think it gets a lot of bad press in the United States because the word social scares a lot of people, but I think it's a great system here, and I wouldn't trade it for anything. I just think there's some very basic things we have here in Canada that are government regulated in a very positive, proactive, and a way that provides for all people, where we can choose what's best for us.